Medical news. Every year, at least 1,000 people die on our roads because of a sleep-deprived driver. We're eating our way to more and more deadly heart attacks, and survival rates for cardiac arrest are dismal, despite good science behind the effort to understand and treat it. But as NBC 15's Sarah Carlson explains, you're lucky to live in the Madison area, where the best breakthroughs are saving lives every day.
It was very scary, very scary.
Faye Langham is lucky to be alive.
Sometimes I'd hit the nightstand with my head.
She was falling out of bed every night because of sleep apnea.
I had no idea, except that I was exhausted all the time.
Luckily, she never seriously hurt herself or anyone else. But the sleep-deprived are responsible for thousands of fatal accidents on the road, among other things.
It has huge economic impact for an individual in terms of their own performance at the job.
But research right here in Madison is taking an unprecedented close look at the sleeping brain. The brand new UW Meriter Sleep Disorders Facility, Wisconsin Sleep, is the only one in the world with the capacity to perform high-density EEG in all its patients.
When you come in to have a sleep study, you have 6 electrodes on your head. With high-density EEG, you have 256 electrodes.
The possibilities are endless, including a better understanding of the strong link between sleep apnea and heart disease.
With untreated sleep apnea, there's roughly double the risk for heart attacks and strokes.
Faye is just one of thousands whose blood pressure and risk for heart attack plummeted after her diagnosis. The second breakthrough is all about saving the heart. The heart attack death rate here of 3% is much lower than the national average of 7%. For a good reason.
I am on top of the brand new rooftop helipad at St. Mary's Hospital, just one part of the major effort to get heart attack patients through the door faster.
It's called Level 1 at St. Mary's, with similar programs at all 3 Madison hospitals. Here's how it works. If someone has a heart attack 50 miles away, the medical staff there are trained to identify who needs to be transferred to Madison for life-saving angioplasty, while the staff in Madison assembles for their arrival.
Reducing our door-to-balloon times by half of what it used to be. Half.
The third breakthrough involves cardiac arrest, essentially a seizure of the heart.
Pretty cool, yes.
It's called CoolGuard. And MedFlight is the only helicopter service in the country using it for all cardiac arrest patients.
The initial 5 minutes on the scene is heart, get the heart restarted. And once that's started, then we say, okay, how do we then maximize brain protection?
That's because the biggest risk is brain injury, and it's too often fatal. But UW MedFlight responders are putting people on ice to stop it.
It's the equivalent of a 4-year-old falling through the ice in the winter who's underwater for 40 minutes, yet is revived and has a normal neurologic outcome.
First responders literally pack a patient on ice until they can get this new device inserted back at the hospital.
So we're after not only improving survival rates, but improving neurologically intact, walk out of the hospital, go back to your job, enjoy your life, survival rates.
All the experts involved agree the Madison area community is way ahead of the curve in terms of working together. They set aside competition to save more lives. There's endorsement by all 3 hospitals to use hypothermia for the cardiac arrest patients. And as we mentioned, all 3 have similar programs to cut back on the time it takes to open heart attack patients' arteries. This is something rare in most cities across the country. Sarah Carlson, NBC 15 News.
A lot of